Gary Cohen is a pioneer of our environmental health movement for more than 35 years. He has helped build coalitions and networks globally to address the health impacts related to climate change and the toxic chemical exposure. Cohen is the co-founder and president of Healthcare Without Harm, created in 1996 to help transform the healthcare sector into environmentally sustainable and to support health and the climate resilience of our communities that they serve. Since its inception, the nonprofit has grown to lead and partner in groundbreaking initiatives in more than 72 countries. Cohen has been awarded the Champion of Change Award for the climate change and public health by the White House in 2013. In 2015, Cohen received the MacArthur Fellowship and a Genius Grant from the MacArthur Foundation. For more about Cohen and his view the MacArthur Awards video awards. Gary, it's just absolutely a pleasure to meet with you again. I think your organization is doing phenomenal work, but I think it's really important for people to really understand why it's so important with other things you do. And the credo that they use all the time is provide no harm, and what type of harm has been provided inside the healthcare industry, and what your organization is doing to bring that awareness, going back to that data and sharing with them that data and how to make a change.
Thanks
Gary,
so much, Gary.
Thank you.
Thanks so much, Jeff. Slides. Yeah, so I'm going to talk a little bit about the work that we do to bring the healthcare sector into this larger movement around food that is both good for individuals, good for the community, and also good for the planet. Next slide. So we started Healthcare Without Harm 26 years ago because we thought if we're going to have an economy that is healthy for people on the planet, we understand that we need to phase out our use of toxic chemicals, fossil fuels, and industrial agriculture. And who better to be leading that effort toward that broader transformation than the healthcare sector, which is 20% of the US economy and 10% globally. And it's the only sector of our economy that has healing as its mission. And so how do we leverage not only just the clinical interventions that healthcare has, but its economic power, its political power, its role as anchor institutions in the communities they serve. They're not going anywhere. They're in service of their communities. How do we leverage all of those assets to support more sustainable, racially diverse, healthier, more sustainable communities? And food is a kind of critical intervention into that broader mission. Next slide. So we talked a little bit about it during this, but we have a food system essentially in this country that manufactures disease. We have incredibly high obesity and diabetes rates. In the healthcare sector, the largest cost to the US healthcare sector are all food-related diseases. Diabetes, heart disease, stroke, cancer. And all through this life cycle of the food system, there is waste created, there is injustice created, there is health impacts created. So the food system is out of alignment with our goal to have healthy people in thriving communities. In addition, we also have enormous food insecurity. So 1 in 6 families in this country, the richest country on the planet, are food insecure. They're not sure where their next meal is coming from. And finally, we understand that as we're making this transition away from fossil fuels, food is a critical dimension of this measure. Almost a quarter of greenhouse gas emissions globally come from agriculture. And it's all those same toxic inputs that are derived from fossil fuels. So we need to transform the entire food system if we're going to create a planet in which it's livable for people. Next slide. The rationale for acting is what I've said. I mean, and the good news is that we can solve these things together. And Kate spoke about that. You know, how do we leverage our purchasing power to support more sustainable growers, more racially diverse growers? How do we use our purchasing to support more local economies, to model what healthy food environments are at, to reduce the agricultural impacts and to support the health of the soil and natural systems, and then to move policy to incentivize the right kind of agriculture that we want in our cities, in our states, in our countries, on the planet. So this is a very complicated slide. You can look at it later, but it's basically the idea that we need to multi-solve, especially in the midst of this climate crisis, where we no longer have the luxury of time to noodle around with this, as it were, for the next couple of decades. We need to act now. Next slide. So we've made a lot of progress over the last 15 years in moving the US healthcare system away from having almost a complete disconnect between healthy people and the food that they served in their vending machines and their patient trays and their cafeterias, and beginning to integrate some of the values and some of the strategies that some of the other speakers have talked about. This slide on the right, the chart talks about some of that progress. So we have a network in the United States of about 1,400 hospitals that are part of our membership organization, Practice Green Health. That's about 20% of all the hospitals in the country. And we've tracked some of the trends in that cohort. We found that 81% are now moving toward less meat. 61% are moving toward better meat. In other words, when we started, most of the meat that was purchased by healthcare was produced with the overuse of antibiotics. 75% of all the antibiotics that are used in America are used in animal agriculture. And some of them are the same that are used in human medicine. And so by the overuse in animal agriculture, we're actually rendering this incredible tool for medicine ineffective. And there's this enormous rise of antibiotic resistance. So getting healthcare to understand, well, we want to move away from the use of antibiotics in animal agriculture to preserve the value of antibiotics in medicine is absolutely crucial. Many of them are moving toward more sustainable purchasing, local purchasing, and they are beginning more and more to do what Kate was speaking about, which is to see food as medicine to food insecurity, food-related diseases in their communities, and moving beyond their hospital walls upstream to address those conditions that are making people sick in the first place, that are making people show up in their emergency rooms, that are making people have these chronic diseases. Because if the entire healthcare system is based on downstream interventions, waiting for people to get chronically sick, we have failed as a society. We spend more money than any country on the planet on healthcare. And yet the vast majority of our interventions are at the waste end, at the end of the pipe, at the time when people are already chronically sick. And we need to move into the communities that we serve to address those upstream conditions. So that's what's starting to happen more and more. And New York is obviously an incredible model for that, because they're screening patients, they're navigating patients, they're supporting the nonprofits that are providing food to people. That's the kind of healthcare we need. Next slide. So speaking of what we discussed the Center for Good Food Purchasing and their standard, and we got together with the Center for Good Food Purchasing and another organization called Real Food Generation, which works in in the sort of higher education sector. And we said, look, if we could get schools and municipalities, hospitals, and universities all to align around a certain set of standards, then we could drive the entire institutional food purchasing marketplace. Because that's what we need. Healthcare is not big enough. Universities are not big enough. School systems, even as big as New York and Chicago and LA, they're not big enough. But if we come together, we can drive the marketplace. So we have been working for the last several years with these organizations to come up with a standard that can align and that can drive the market in a New York City situation where the hospitals are aligned with the universities and with the school systems. And so we're coming out with that standard this fall that supports animal agriculture, supports local issues, it supports racial diversity, it supports sustainability, planetary health, and trying to come together around that set of standards. And that may be something that will be certainly promoting among our hospital cohort, but hopefully some of the networks that are also represented by the Center for Good Food Purchasing and these university networks. Next slide. Part of that is obviously plant-forward diets. We just heard about that. There's a great amount of momentum from health-based reasons and climate reasons to move away from industrial meat production, in particular from beef and chicken, pork. And so we've got some analysis of what are the benefits of nutrition and price and environment-related beans and beef. We've partnered with the World Resources Institute on a cool food pledge so that hospitals now, about 65 hospitals, have adopted the cool food pledge to reduce their amount of meat on the menu and move toward plant-forward diets. And for the chefs that are listening, we have a healthcare culinary contest. 15 years ago, it would have been seen as absurd to have a contest among chefs in hospitals. But as we know now, high-class chefs are being trained, as Warner talked about, and others are presenting today, coming to hospital systems and serving incredibly healthy, good food, and having hospitals model the kind of food environments that we want in our homes. So we have a contest every year on this, and the results are then shared at our annual conference called Clean Med, which next year is in Pittsburgh in the fall. Next slide. Part of the strategy is also addressing the life cycle. And so food waste solutions are really important to move away from just throwing out all the food or having it wind up in a landfill. And so there's a number of programs around the country now that are recovering food from hospitals in particular, and then distributing them to nonprofits, to food kitchens, to community NGOs, composting, and then having the compost then come to grow food. There's a hospital, several, but there's one in Boston Medical Center, that is actually growing food on the roof of their hospital. And that food is then going to patient trays, going to a food clinic, and going to a teaching kitchen, teaching moms and dads how to cook a meal for their family for $10 or less. So beginning to see these kind of righteous cycles of food production, distribution, use, composting, end of life, recycling, all that is really part of this overall strategy. And the state of California is requiring hospitals under a new law to do recovery for food and not to be throwing food into the landfill. So last slide, I think it is food as medicine. And I think what Kate described is seeing the delivery of food, seeing food as a covered expense in healthcare, so that more and more Medicaid and Medicare will start reimbursing hospitals and clinicians to screen patients for food insecurity and food-related diseases, to help them navigate to those resources in their communities, and to support food as an actual intervention. It has taken a long time to get to this place, but the momentum for reducing healthcare costs, the chronic disease in America, and linking that with more sustainable and racially diverse and equitable, climate-friendly agriculture, all of that is now coming together in a more integrated strategy. I think that's the last slide, but let me see. Yep, that is the last slide. So thank you very much for listening, and I look forward to being part of the roundtable. Thanks.
Thank you, Gary. That was absolutely empowering and impactful. I look forward to the roundtable. I think you're going to have some great questions. But again, thanks for leading the change, being that change agent, leading the change within the healthcare industry.